Hey everyone. Everyone in healthcare has a story that they never forget. Some are beautiful, some are difficult, and most actually are never told. This is the space where doctors talk about the moments that changed them. Welcome to HUMED, where we talk about the emotional, moral, and humanistic realities of medicine. I'm Dr. David Spiro. Thanks for being here. Please hit subscribe. We've been fortunate to have pretty exponential growth in subscribers and appreciate everyone that's listening today. I'm incredibly delighted and honored to have Dr. Maya Roberts here with us. Maya is a staff clinical lead at Google. If you've heard of Google before, I'm kidding, driving healthcare innovation through Gen I research and product development. She's formerly the deputy director of the Clalit Research Institute and the senior director of medical strategy at K-Health, with academic affiliations at Mount Sinai and Ben Gurion University in Israel, and advisory roles at Center for Public Health Leadership at Harvard, the Taub Center of Health Policy in Israel, and Startup Nation Central. That's a lot of jobs. Maya holds a BA in physics, an MD from Yale, an MPH from Harvard, is a board-certified pediatrician, public health physician in both the U.S. and in Israel. Maya and I met when she was a medical student at Yale University, and I was an assistant professor there, and bonded on many levels. And I'm incredibly honored and delighted to reconnect with you and have you on the show.
It's absolutely such a pleasure, and it feels actually in some ways like many, many things have happened since, but also like no time has passed. There's a connection that we share, and I'll get into my story.
Yeah, so just real quickly, we had a very you had talked before the show that you have three beautiful children, and your daughter's name is Yael, and we had a very close family friend who we were very close to, and one of their daughters was named Yael, and there's something about that name that is just so beautiful. What does Yael actually mean in Hebrew?
So it's alternately translated as mountain goat or gazelle. And to my daughter's frustration, we didn't name her Yael for any other reason except we really like the name because it isn't a very good name. It's actually a very common name. We know a lot
Mm,
of Yaels. And there was no debate whatsoever when we knew she was going to be a girl. It was very clear that this was going to be her name. So we're delighted to join in that tradition.
awesome. Well, let's get into the story. Would love to hear what you have to share with us today.
Sure. So my path to being a doctor probably differs from a number of others. I was actually a physics major, and I loved physics. I still love physics, but over time it became very clear that not many other people love physics like I do, and the chance that I would have to make a change in some way in the world was going to be really limited. So I spent some time in college kind of exploring other disciplines. And one of the things I always liked was languages. I ended up in Nepal for a semester and beyond, mostly because the program was supposed to teach you Nepali, which I thought would be, super, super useful, but at least very cool. And I certainly learned a lot. It was an incredibly challenging time. This was in 2001. I was there during 9/11. I was there during, at the time, the Maoist revolution. And there were a lot of different major world components that were shifting and changing. And all I could see really in Nepal at that time was that everything seemed to be at a standstill. And while I was there, we had to do a sort of mini thesis. We had to study something, anything. We could choose anything and anyone. And our program was deeply connected to all senior ministries, and we could connect with them. And lots of people were connected to their original discipline. I wasn't going to connect to physics, but one of the things I did feel very strongly was that the health of the community seemed to be driving all of their decisions. People couldn't work if they were sick. People couldn't go to school if they were sick. And so, somewhat reluctantly, I opened my door and said, "Okay, well, maybe health is a space I'd like to explore." And I ended up in a very small village, about a 3-day walk from the second largest city in Nepal, called Pokhara. And this village is actually called Sickless, named as such by some British hikers who had gone through and noticed that no one there was sick. I don't know if that was true or not, but this is the name that they had inherited. And I had gone there to observe a local clinic and see how it interacted with the village. Now, as happens with young, idealistic, and perhaps overly confident 20-year-olds, when I got there, I was a little surprised by two things. One is no one in the village actually spoke Nepali, which I had just spent 6 months learning. And two was that there was no doctor in this village at this clinic. So a couple things happened. One, I learned the local language, which one can do at 20, it turns out, called Gurung. It doesn't have a written format, but I had to learn it because the kids kept making fun of me. So I had to give it back to them. And I learned how to interact with the kids and I learned their names. And I spent a couple weeks doing that, waiting for the doctor to show up. And the locals were telling me the doctor would come Ajaboli, tomorrow, the next day, which I subsequently learned we have no idea when the doctor will come. Please stop asking us. Eventually, in the last week, the doctor did come. And this is the point in my story where at this point I had this vision of there's this empty clinic and I don't want empty clinics. I want doctors. I want people there. And this doctor came and he was a bit of a curt fellow in his mid 50s. And he showed up with a little thermos, hiking those 3 days. I mean, he hikes village to village. And when he showed up, he kind of seemed more or less grunted at me and kind of set up, not super interested in anything I had to say or learn, which was fine. And then promptly the next hour or so, the kids started lining up outside and I was kind of joking around with them. And I started watching him. And what he would do is he would take out the polio vaccine from his thermos, which kept it cold. And he would put a drop. This is the oral version. He would put a drop on each kid that comes in and then stamp their hand. I kind of watched from the side. And I noticed two things. One, he didn't speak the local language. At this point, I kind of did. And two is he didn't check their names. He didn't check if they'd already received the polio vaccine. He didn't check their ages. Just the kids lined up, he gave them the drop, they moved on. So this went on for some time. It wasn't a big village, but it was big enough. And I asked him at the end, and I said, "You gave all the kids polio vaccine?" And he said, "Yep, yep, I did." And I said, "Do they all need polio vaccine?" And he said, "You know what? I don't care. This is what I'm here to do." And I couldn't help but think, wow, this is a really bad doctor, right? Why did I wait for 3 weeks to meet like the worst doctor in the world in this village who's giving all these kids polio vaccines? So I sat there for a little bit in my sort of self-impressed mode of knowing that one doesn't do this. And got up the courage and asked him, I said, so why did you give all these kids a polio vaccine? And he said, look, I'm 56. I have friends who had polio. I can't do much. I don't speak the language. These kids, they don't even know their names. There's one thing I can do, and I can make sure that no one in this village is going to get polio. And I can give every single kid, every single time I come, a vaccine. And I realized this actually wasn't a really bad doctor. This is actually a really good doctor who was in a really bad system trying to do a really good thing.
Trying to
I
do a
think that's
really
my
good
story.
thing and trying to do one thing as best as he can, like focusing on the one thing that he can do well.
Absolutely. Absolutely.
It's funny. That's a beautiful story, and I don't know if I'm interrupting or there's more, but um, when I worked 8-hour shifts, I'm still a pediatric emergency medicine physician. I still love to do what I do, um, but when I'm working with learners, I'm working with students, I'm working with resident learners, and my perspective after doing this for almost 30 years now is that if I can teach a resident or any learner one thing in 8 hours, one thing, I consider it a success and something that they can incorporate for the rest of their lives. Um, we had a GSW gunshot wound last night. I was working sort of late, and I had some uh, students with me, and it was an incredible opportunity to take them through what we're doing, why we're doing it, and there was a teaching point there. And so um, I'm curious what inspired you. We have a number of learners who folks are in medical school, early physician. What actually inspired you to go to Nepal and Pokhara? And I'm familiar with Pokhara. One of my friends started a nonprofit there about 15 years ago, and semi-adopted some children. And I know Pokhara is a beautiful city, but then you were a 3-day hike from Pokhara, so in the middle of rural Nepal. What actually inspired you at the age of 20 to do something like that?
I think at the time it was clear to me that I had not seen enough of the world and of different kinds of people. I would be remiss to say that I hadn't exoticized Nepal as well, right? Like there's images that probably anyone listening has in their mind of what it might be, which were promptly probably not consistent with what I saw when I first landed. But I think it was very clear to me that I was in a very sheltered space. I was in my physics lab, and that was just not going to cut it for me. And I needed to find an opportunity to learn a lot more. And I think over and over again, this is one of many stories that I have from my time there, where I was so sure that I knew something good about the world or something right about the world, and I was just so very wrong. Not because of malintent, of course, but just there's just a lot to learn from different realities that people experience. It was not an easy time there, but there's no doubt that it is what fundamentally shaped my approach, both to the rest of my personal life, but also to the rest of my professional life as we think about absorbing those new inputs and readjusting our new reality.
Yeah, it's interesting. I had the fortunate privilege of spending time in Central South America, also in Eastern Europe during difficult times decades ago. I have felt with the few experiences I've had in the developing world that I actually get more out of it than I can actually give. And I'm curious what your perspective is about that. Do you feel like we can you talk a little bit about the juxtaposition of growing up in the States, growing up in a more developed place with the creature comforts that we have, and then going to see what life is really like? As you mentioned, you had an image prior to arrival that was different than when reality set in. Can you talk a little bit about that?
Sure. I think when I had pictured or prepared for going, I had pictured a fully rural environment, beautiful pastoral rice fields, lots of green, mountains. And when I arrived in Kathmandu, it was this very noisy, very dirty, very messy, um, lots of people in the streets, city. And when I arrived at my host family space, I'm actually still in touch with my host family all these years later. Um, they were both welcoming and cautious, as one would expect a normal human to be. But as a 20-year-old arriving, you it's not entirely surprising. You build up this anticipation and excitement. And it was a very important awakening for me to start seeing the other. And as you say, that moment where you realize, wow, my life is going to be permanently changed by this experience, but I don't really know what these people are going to experience on their side, and
Hmm.
whether their life is basically going to continue more or less as it was. And I think that that story has carried through for me. I've had a number of opportunities to reconnect with various groups in Nepal since, including groups that have visited here in Israel. And I think when I see that, I think there's a part of me that says, you know, I really wish there was some way to reshape and to provide so much back from what I have gotten. I don't know that there is. I would hope that I bring that to my story and to my profession in a way that disperses, but, it certainly doesn't compensate this doctor who was, really, taking a very, controversial stand to do what I believe now to be a very important mission. And he's just there, right? Like he just did it for no help. No one was checking in on him. There was no chart review going on there. And he did it because it was the right thing to do. And so I think there's no way to repay that except to pay it forward.
So you were a physics major, physics lab, doing the things that physics majors do, and then
Indeed.
you had this experience. Did did this experience inspire you to apply to medical school, pursue a degree in public health? How much of this experience and this engagement with this wonderful physician that you work with and were able to observe, how much of this influenced the career that you've had, this incredibly successful career?
Um, this is all entirely due to this experience. I will say that.
Really?
Oh,
Wow.
without a doubt, without a
Wow.
doubt. I think I left that village. I still remember the morning that I left. Um, and I kept thinking both about the doctor and the uncomfortable but important conversation I had with him. But I also kept thinking about the empty chair that I would see every day for several weeks when I walked by. And what I've now come to articulate, many years later, having gone through medical training, is that it is entirely unjust that for these people, basically 29 days of the month, there is an empty chair. And that's what a doctor to them looks like. And I felt this firm desire to fill that chair with something, whether it was somebody or something. Now, of course, decades later, it's very obvious that there are many technological interventions. That wasn't obvious back then. In fact, the story I often tell, so Google was founded on my 17th birthday. Okay?
Mm.
So more or less, I had just started studying physics when Google even first existed. And as a result, I think when I think back to my story, there are all these dots that you can connect and retrospectively, but that's certainly not how it happened at the time. And at the moment, I think I was very torn between saying, well, public health is clearly what I'm committed to, but it's not clear to me that that's the place where I can intervene. It kind of seems like I need to also be a doctor to kind of know what I'm talking about and to make those really difficult decisions in real time. And so it was always pretty clear to me that what I wanted to do was change the system. And it kind of seemed to me that the right thing to do was to be a doctor to do that. In retrospect, that's a very long road to get there. Um, but I do think that that combination of experiences, it both made me a better clinician to have that experience superimposed, and certainly having been a clinician, informs everything I do, both in research and in product development, around thinking about the whole system, and ultimately always kind of asking the question: Are we making it easy to do the right thing? Are we going to make it harder? That's what's going to drive me every single day.
So you would it's funny you had talked about Google, and I want to talk about your current role now because I consider myself a technologist to some degree, and we're trying to incorporate artificial intelligence, generalized learning, what I like to call collaborative intelligence, into the workplace here at Arkansas Children's. But I have a distinct memory, and maybe you'll remember this, but I have a distinct memory of you sitting in my office in New Haven and you describing to me what Facebook was. And I don't know if you remember that, but
Oh my
you
gosh,
said,
I do.
David, don't friend anyone that you really don't want to be friends with. So I have a very distinct memory, and it's sort of, one of the things that I love about academics and mentoring and being mentored is that, if you have a really good mentee relationship, the mentee teaches the mentor many things as well. It's sort of bidirectional. But that certainly was a moment that, even though I was in my late 30s, early 40s back then, it's like, wow, Facebook, kind of weird. The internet, kind of weird. Google just started when you were 17. So I'm curious if you can share, what your role is at Google and what you're doing to impact healthcare in the form of technology.
Yeah. Uh, well, a good chunk of what I do at Google, you would never know that I did it at Google, and I actually really like that. I like working on again, that fundamental framework of how care is delivered. But the piece that gets really exciting for me, and honestly was actually the opposite of which is very challenging for me as a clinician, was, and I guess this is another little mini story, but when I was a resident at Mount Sinai in New York, I felt like I was seeing the identical kid with asthma every time in the ED. I mean, not really the identical kid, right? Like different names, slightly different age, but the exact same profile. And I felt like there was somebody upriver just pushing these kids in, and I was downriver just pulling these kids out, and kept thinking someone should stop pushing these kids into this asthma mess, and we should not have to do this. This doesn't make sense to me. And the thing about Google that makes a lot of sense to me is that you can do that at scale, right? Like you can tackle some of the biggest challenges, some of the biggest myths, some of the biggest access to information you can do at a scale beyond what any single pediatrician could do in the course of their career. Literally billions of people, right? Like there's something that's so grandiose about that, and yet also actually true. That's incredibly exciting for me. And I think the pieces that I'll get a little bit to what I actually do, but the pieces that clinicians like me who are at Google, and there are a number of us, really connect to is many of us come from this experience of being in the clinical space and just feeling like our hands were tied and we just couldn't get out and do what we wanted to do in the confines of the clinic, and that it just required something bigger. I don't think everyone has to be at Google. I think you can get bigger without doing it at the biggest, one of the biggest techs. But Google did provide that opportunity within research for us to explore that. So Google's it's very large. There's 180,000 people. And the story I often say is at some point in residency, you choose whether you're going to be at a pediatric hospital where everything's like balloons and clowns and colors, or you're going to be at an adult hospital that has a pediatric ward. Um, so Google isn't a pediatric hospital. It's not built for health. It's basically an adult hospital. It's built for lots of other things, but it has a health component. And there's a part of me that has to kind of swallow my pride as I walk into work every day because I'm one of a much larger machine. But the thing is, if you can harness it, even a small part of that machine for health, you have this tremendous opportunity. And so the pieces that I work on specifically are right at the intersection of research and product. And it's a little different from the academic world in terms of clinical research, although we do some of that. That's less of what I do. I work on making the models great for health. Okay, so many people, including presumably people from that village, the first, if not the only medical care they seek is through a web search, often through Google, right? And some of the stats from the WHO is half the people in the world do not have access to primary care. Okay, that means that a good chunk of the people in the world in their whole lives will never see a doctor. But a lot of people will have access to a search engine. And this opens this whole world to say, sort of, what is the kind of information that we want people to be able to have? And this is a really, really hard question, it turns out, right? Even before all the generative AI, this open question of how do you empower people with information, knowing that in certain places there's a limited range of actionability that they have to act on it. What are the kinds of information that people want? Sometimes people want to hear something that is really tough to tell them. How do you convey that over a search engine, right? How do you connect them? And it turns out there's lots of different ways to do that, some of which are things like YouTube and education and partnering with people who are experts in education and experts in communication, where we provide the platform and they take it forward. So those components are incredibly exciting to me of building that infrastructure that allows both Google to surface information for others, but that allows others to take that information and make it even stronger.
Well, that's fascinating. So I was reading an article recently about a company, a startup company that takes information from a person and labs and lifestyle, potentially wearables, and puts it all into a collaborative intelligence kind of platform and gives recommendations based upon all of that. And this one um, author was talking a little bit about how it profoundly gave him some insights that he may not have seen. And one of the commentaries of this piece was, how does that really, how can that supplant and replace a physician that has 30 years experience and knows that person in a different way than than generalized intelligence might? And I'm curious what your thoughts are about that, because obviously there's the search engine and then there's the AI piece that Google has, Gemini. But are we at a point, or will we be at a point where you can actually engage with a computer interface on a personal level and give reasonable advice to folks? Is that, do you think that that's the future of some form of medicine?
So I'll share a couple perspectives about this. The first is that when we look at sort of side by sides on data sets, we start learning some really interesting and often unexpected lessons about what generative AI is very good at. We learned that doctors think less of their peers who use AI, but then even when the AI is usually right, they'll tend to use it themselves. We know that when you do AI versus AI with doctors, even when doctors are surface, the correct diagnosis with AI, they'll still turn it down. And I think this tells us that we have a long way to building trust. And without what our former chief health officer would say, health moves at the speed of trust. And it's one thing if users trust or don't trust AI, and it's a whole other world to get into to have doctors trust AI. And I think we have to earn that trust. I think the flip side. So I'm 44, and let's say I have somewhere between 10 and 20 years of my career left. I think there's no doubt in my mind that over the course of my career, there will be some version of generative AI that will be readily able to replace most doctors, if not all. And what I used to say a couple years ago was it probably won't be in the next year, but maybe in 5 or 10 years. But I don't know that I can even say anymore. It probably won't be in the next year. And one of the other points of data that I like to share is when you look at empathy, AI often outperforms humans. And so we hear this sort of gravitation to these years of experience, and I know the patient and I know the family and I know what it's like to know a patient and their family. But at the same time, we're trained on the job in empathy. um, and there's only so much feedback and coaching we get along the way. Whereas generative AI is literally trained to be incredibly responsive to the user. That's what it's trained to do. And I think we would be remiss if we didn't think of ways that we can embrace that, Another point is if you show up to your doctor in the afternoon, you're less likely to get offered a flu vaccine than if you show up in the morning, right? Doctors are humans that get tired and we make mistakes. And I like the way you said of this sort of collaborative intelligence, that the space I'd really love to see us in this interim period between where we are today and where we'll be when we have a lot of trust in these technologies is, how do we collaborate? How are we honest with our shortcomings, right? How do we understand why we're doing what we're doing? How do we make the easy thing to do the right thing to do? And how can we really embrace what technology has to offer for us? This is incredibly tricky. It pivots all the time. The models change all the time. But I think this is our current responsibility as clinicians, as stewards in this field, because we come with this passion and we come with this experience, and we also have to come with an understanding of our shortcomings and where we have an opportunity to fill those in.
Yeah, I appreciate that. I've often thought, so that trust question has come up in my readings as well, in terms of doctors and patients needing to trust the information that they receive. Um, it feels like, and I'm curious what your thoughts are about this, that one of the limitations of looking at a screen and getting information and trusting it and then acting on it is that it's a screen. It's some computer interface that looks like a computer. Uh, we are making rapid advancements in the field of robotics, and I give a talk about the future of pediatric emergency medicine, and I'm convinced in the next 5 to 10 years we'll have robots. We'll be living with robotic uh, devices that will look more and more like humans. And I'm curious what your thoughts are about the idea that ultimately robotics, plus obviously integrated with generalized intelligence, how that might shape medical practice. Have you thought about that?
So, yes, I have.
I have a feeling you did.
Just, in my spare time. Um, there are some incredible opportunities that would be served, even, for example, by that empty chair, right? And there are lots of reasons to think that physical embodiment of the model is a very obvious opportunity for us to get into. And one of the pieces I would highly recommend, if you haven't seen it already, is the Netflix or the documentary, the Thinking Game, which is on YouTube. Um, and it's follows Demis with AlphaFold and Google DeepMind, um, around sort of how the development, how Google DeepMind came about and how it grew, and kind of culminating in the Nobel Prize for predicting proteins, like all the proteins. Which, by the way, when I was in medical school and I sat in that lecture hall, and the professor stood before us and said, "This is impossible to do, right? You cannot predict protein folding. It is beyond the capabilities of mathematics." And here we are within my career, within my lifetime, where it's not only possible, but it's like done. I think the piece that is as emphasized in the Thinking Game, which I really related to, is that AI learns very differently from humans. So, um, many of us in our medical career, we tended to be good at things. Okay, we tended to be top of our class or top of something, and so we are already really good at things, and then we were taught a new thing. Okay, and we leaned on the things that we were good on to do that. But AI learns very differently. In fact, when AI starts, it tends to be really bad at things. And it takes a totally different mindset of computer science to be okay with that and not just throw that in the trash. And the story that's told is actually, for the first most of the time they worked on this project, they were actually really bad at protein folding. And that it takes all this reinforcement learning and being able to play games at scale and to iterate at scale, and suddenly you get very good at something that no one else can do. And so when I think about the opportunities for robotics and beyond, right? I think that there's going to need to be amount of time. We need to be very comfortable with very silly looking robot videos, right? And we need to be able to absorb that and embrace that. To my mind, that's part of that learning curve, which again looks very different from what I'm used to. But what I've learned to embrace is the more that we try and fail in, the simulated environments, all of a sudden one day, basically, we're going to be almost ready. And so that's to me is one of the really exciting pieces about being a doctor at this time in development of technology is to be able to both see amazing things that already exist and to see very silly looking robot videos when you're trying to say, okay, what could we actually do with that? What could we learn from that? And that's going to be a new horizon we can tackle.
It's, I'm excited about it. I know that there are, and I share that enthusiasm with you. I really do. And I think that that said, that there needs to be some safeguards with AI and generalized intelligence. And there are um, really thought-provoking leaders who've really shaped what we now know as AI, generalized intelligence as well, that have expressed all sorts of ethical and um, serious concerns about it. But I do believe that there is going, like with anything, it's usually not just a black and white issue and a dichotomous, and there will be strengths and limitations as the technology develops. But I guess my last question, and again, this has been such a beautiful time spending with you, is you spent a lot of your time, and when we met, we were in Connecticut, and uh, you spent a lot of time in the States receiving education. What was, on a personal level, what was part of your calculus and moving to Israel?
At the time, so this I moved now in 2013. So it will be 13 years this year. But when I started seriously considering making the move, it was actually launched in fair part by a career opportunity. I was a fellow. I was doing a fellowship in pediatric environmental health at Mount Sinai and with the New York City Department of Health. And um, during my medical school training, I had gotten an MPH at Harvard through a program at the Center for Public Leadership, and they had encouraged students to be cross-disciplinary. And I had had an opportunity to take courses in health economics and food policy and across the board. Um, and during that time, I had met an incredible clinician, family medicine doc, Avi Goldberg, who's now head of a hospital here in Israel, and had an opportunity really to learn about the systems in Israel. And there's a very special combination of criteria, both it being a very combined small country, but also highly regulated and having effectively a closed medical system. It effectively has four separate health funds that have the same requirements and the same delivery of care. And one of these systems has been keeping data now for decades in an electronic health record. So when I was doing my fellowship, the VA was maybe the closest to having something sort of like that. But obviously in a distinct population. And all of a sudden there's this idea that there's a group in Israel working with 4 million, the largest health fund working with 4 million people, 10 million over the course of the decades of all their electronic data, all within one system. And there was a group trying having basically a think tank. This is the Quality Research Institute that would basically use those data to drive the healthcare policy of that health fund. Who most urgently needs the flu vaccine? Who has not shown up for their colonoscopy and desperately needs it in the next month? And you can run models on the data and then introduce the results from those models back into the healthcare system. And to this day, this was one of the most magical times in my career because it sat at this nexus of clinical care and healthcare policy and research. And one of the pieces that I liked the most about that experience is that we were not allowed to publish. Our goal in being there was to be the doctor in the chair. Our goal in being there was to be able to provide insight that a single doctor can't see, but a collection of thousands of doctors and millions of patients would be able to see through the data. Now, of course, machine learning makes a lot of that work obsolete. But for me, it really drove that sense of there's an opportunity in a particular time in a particular place that got me, some incredible experience in in epidemiology before COVID, and epidemiology was cool. But really to ask those tough questions of what are the data that we want to use to make a difference in people's lives, and that really drives me today. And that was super exciting for me to get to connect to. And really at the time, Israel was the only place that had, and to a certain extent, still the only place that has those kinds of data available. So that opened up a whole other set of doors for me to really learn from and grow with.
Interesting. And now you're raising three beautiful children and living in Tel Aviv. Is that correct?
Living in the center of Tel Aviv, I ran along the beach this morning, about a
Wow.
half a kilometer
Wow.
away. Yep. Yeah, yeah,
Wow.
yeah. And so there's a richness in life, complexity too, but a richness in life. And the last piece I'll throw into is there's a reason why there's a thriving startup world here. There's a combination of data and this belief that we can kind of make it better. We can find a way somehow to make it better. And that's very exciting to me as a doctor. I think that's not what medicine often is for many people, but it's something that I believe that medicine can and should be, for those who are looking for it.
When we worked together 20 plus years ago, you inspired me back then in terms of your enthusiasm, your passion, where you were heading. I knew you were heading to great things back then, and I continue to be inspired by you, Maya, and what you're doing with your career, what you're doing with your family. And we all go into medicine, and we talk about this when we apply to medical school. We all go into medicine to make a difference, and I honestly think that you're doing that on so many different levels. And love the story about your experience in Nepal and how that inspired you. And really, you're inspiring me to come visit you in Israel and make my first trip there, which um, has always been a bit of a dream for me. But would this connection has been very special for me. Thank you so much for joining us today.
Well, thank you so much for inviting me. It is what a wonderful opportunity to tell our stories. We tend to keep these kind of locked inside our hearts, and it's very special to be able to share both with you and obviously to everyone listening. Thank you. This has been a joy.
Thanks, Maya. So, those of you that are listening, please subscribe on YouTube or wherever you get your podcast listenings done. This is Dr. David Spiro signing off. I hope you all have a great rest of the day. Bye-bye.
Thanks for listening to HUMED with David Spiro, MD. If you like this episode, make sure you're subscribed on Spotify, Apple, or your favorite podcast platform. The video versions are also available on YouTube. Make sure you subscribe and hit the bell there so that you never miss a future episode.